Welcome to Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. My name is Dr. Chinwe Eferibe, and I'm a pediatrician and adolescent medicine physician in Round Rock. I will serve as the moderator for our panel today. Now, the mission of the Austin Black Physicians Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com to connect with us. That's Austin, B as in Black, P as in physicians, A as in Austin.com. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone in our community to have the knowledge to care for themselves in the best ways possible. Please share this webinar widely. Now, in honor of Breastfeeding Month and Black Breastfeeding Week, which is August 25th to 31st, our topic today is breastfeeding basics for Black mamas. Now, this topic is important to ABPA and the Black community because of three things. Number one, breastfeeding has many health benefits for babies and mothers. Number two, in the United States, Black moms breastfeed at a lower rate than white moms, as much as 10 to 20% less. And number three, they also breastfeed for shorter periods of time, so Black babies get less of the benefits. Now, joining us today are two Austin area Black physicians who are experts on this topic, Dr. Danielle Arnold and Dr. Kimberly Coleman Henderson. Thank you so much for joining us today.
Hi, I'm glad to be here.
Awesome. Now, could you introduce yourself to our guests, please? Dr. Arnold, we'll start with you.
Hi, I'm Danielle Arnold. I am a pediatrician and I primarily take care of patients who are in the hospital. So I take care of a lot of newborn babies. So I get to be there in the very first days when moms are bonding with their babies and establishing breastfeeding. I am a mother of two and went on my own breastfeeding journey with ups and downs. And so I'm passionate about helping moms breastfeed, and especially Black moms.
Awesome. Thank you. Thank you. Dr. Coleman Henderson.
Hi, I am Kimberly Coleman Henderson. I am an obstetrician gynecologist with Lone Star Circle of Care in Round Rock, Texas. And I too am very passionate about breastfeeding. Also, as Danielle said, my first son quit after 1 month because I thought it was too hard. I was doing something wrong. I was 21 years old and I really didn't have anyone to tell me that it was hard for everybody. I thought something was wrong with me. And 2 years passed, my best friend got pregnant and she was like a superstar breastfeeder. And I was like, okay, next time I'm going to stick to it. And so breastfed for almost 6 months with my second son, like pumping after I went back to work. And so I know anyone can do it. And I like to remind moms that it is hard for everybody at the beginning. It's like riding a bike. You don't just jump on and go. So once you stick to it, though, it becomes easy.
Awesome. Awesome. You guys bring a wealth of knowledge, a wealth of experience. And so some might be wondering, what's this big deal about breastfeeding? Why is it so important? Dr. Arnold, would you like starting?
Sure. So breast milk is the optimal, the best feeding source for your baby. It's the best. Nothing else can beat it. There are no other things that we can make in a lab that can match the nutritional content, and we can't match the antibodies. There's special parts of breast milk that help protect your baby against infection. And so babies who are breastfed have lower rates of ear infections. They have lower rates of respiratory infections, so infections of their lungs like pneumonia, lower rates of type 2 diabetes, and they are obese or overweight at lower rates. There's also some studies that say that babies who are breastfed have a little bit more intelligence, a few more intelligence points, and then some hand-eye coordination. So I tell people, you know, your kid is going to could be the quarterback or the neurosurgeon, right? Because they've got that hand-eye coordination. So there's lots of benefits to your baby. And then we know that breastfeeding relationship helps moms and babies bond. So it really helps to secure that bond with your baby. And so two organizations that really talk about what we should do to take care of children, the American Academy of Pediatrics and the World Health Organization, they both say that the best way to feed babies is breast milk only or exclusive breastfeeding for the first 6 months. So it's a big deal. It can change really some of the outcomes that we see and make people in our community healthier.
Thank you. Thank you so much. And Dr. Coleman Henderson, what would you like to add in terms of
I would
benefits?
just say that there are some benefits to mom also. And so one of the things I like to encourage my mothers in breastfeeding is because it actually helps you to get back to your pre-pregnancy weight a lot sooner. You know, all those benefits to the baby that Dr. Arnold spoke about are great and very important, but there are benefits to mom too. It decreases the risk of ovarian and breast cancer in the future. It decreases the chance that women will have hypertension in their or heart attacks in their future. And so we have, you know, every day we're learning new things that have benefits because research is, you know, constantly evolving. And so there are a lot of great benefits to mom too.
Awesome, awesome, awesome. Now, with all these health benefits, why is it that Black women don't start or even continue breastfeeding? Dr. Coleman, would you? Coleman?
Yeah, so there are a lot of things. So um, with women, you know, now sometimes having to get back to work, they don't think that it is going to be possible to continue the breastfeeding. So they're a little discouraged just to even start it. I think that also there, you know, there's those myths out there that the formula is better for the baby, that it's easier than breastfeeding. And all those things really are myths because it's, you know, actually easier for the mom. We'll talk about that later, but it's actually easier for the mom to breastfeed. And then there's just some social norms, like if no one in your family breastfed, you know, your family can be very discouraging to you to try it because they weren't successful or they didn't try it. And, you know, there are some contextual things, we won't get too deep, but there are some contextual things that are coming out even that go back to slavery and about women being nursemaids to their masters. And so that negative connotation with breastfeeding, you know, more recent literature has shown us that that has been passed down in the African American culture, that it was not a good thing to be, you know, to be able to breastfeed because then you were breastfeeding other people's children. And so those negative connotations have passed down over the years. And so there's a lot of different things within our culture that are out there discouraging us and our young moms from breastfeeding. And so hopefully, you know, talks like this will encourage them.
Definitely, definitely. Dr. Arnold?
Those are all great points. I would add that sometimes it's just about not knowing. So not knowing how good breastfeeding can be for you and your baby, and then not knowing some of the challenges or what to expect when you start off. Because it's not, I think people have in their mind that they're going to have a baby and it's going to be just beautiful and they're going to put that baby to breast and then Lauryn Hill will start playing in the background and it'll just be, you know, this glorious moment. And I tell people that, you know, it's difficult. Their body has done something really, really complex already, you know, grown a baby, had a baby, and then we're asking you to do something that may be unfamiliar and you're not sure if it's exactly what you want to do or right, or if you're doing it right, or if your baby likes it. So there's just a lot of questions about what's normal and what to expect. And I do think sometimes healthcare providers, they often know that Black women don't breastfeed as often. And so they may not be as supportive. They may sort of say, oh, I don't know, she's a Black woman. Most Black women don't breastfeed. So I'm not going to push it. I'll give you some formula. Mm-hmm. So I think that, you know, if we're not coming to the game educated, like knowing what the benefits are and knowing what the challenges will be, and then when we run up against those hard things, that's tough, you know. And so if you've got not a supportive job when you go back to help you pump, or not a supportive family, then that's another set of barriers. But they're not barriers we can't overcome. So.
Yeah, definitely. We've definitely survived a lot more and have the tenacity to get through. And there's even this bill that I heard was passed in Congress about allowing employers to provide a safe space for mothers to nurse at work, or and I think it was it break time for breastfeeding. It's allowing not just a space but the time during their work hours. Now, the thing is, some of our Black families and populations, it might be hard for them to have employers who are able to, enforce some of those rules and policies. But definitely a lot of opportunities for our Black families to be able to be encouraged. Now, to dig a little deeper on what you guys have mentioned, I'm sure there's some moms who've come to you with certain either myths or philosophies or just sayings. What are some things that some moms have told you are reasons that they haven't been able to breastfeed? Dr.
I'll
Anderson?
start. Yeah, I'll start. And so, one of the biggest ones is they think that their breasts may be too big or too small to breastfeed. Usually on the small side, people think, oh, I'm not going to produce enough milk, but the size of your breast really doesn't have anything to do with how much you produce. And then women with very large breasts are very concerned about smothering the baby. My boobs are bigger than the baby, like, or bigger than the baby's head. So am I going to smother the baby? And so there's different holds, there's different positions that you can have the baby in. And so pretty much anybody can breastfeed. It doesn't matter, what size your breasts are. I think another one is, about concerns about medications, like if they were already having health issues that they take medications for. But the good thing is we have a lot of data about the safety of medications, because breastfeeding has been going on for forever. So there's good data out there to know if things are safe, or we usually can give alternatives of what you're on to switch to something that would be safer. So that's one I get a lot of, or those are a couple of the concerns that we get a lot of.
Mm-hmm.
I would just add to that one. I was taking care of a mom recently, and she had just had her baby and she was happy and the baby was healthy. And I said, do you have any questions? And the first thing she said was, when can I have a margarita? So, obviously we want women to drink, in moderation for their health. That is important. Or, drink or abstain, whatever is the right choice for you. But, it doesn't mean that you have to completely abstain from alcohol. It is, okay to have appropriate amounts of alcohol. And then oftentimes what we ask moms to do is pump and dump. So they may pump that breast milk and then not give it to their baby, and then plan for the next feeding to continue their breastfeeding. So just to go along with the medication question, I have heard that too. So
Definitely, thank you. Now, what about the cost of it? Because some folks feel that formula is actually cheaper than breastfeeding. What
yeah.
say you?
So when we look at the cost of formula versus breastfeeding, it doesn't cost any money to get breast milk out of your breasts. It comes for free. And so in terms of cost, this is like the best bang for your buck. You're giving your baby something that nobody else can give them, and it's free. Now there is, lots of things out there. Are lots of things out there on the market to help you with breastfeeding. So a breast pump is a huge help. Most insurance plans now will cover a breast pump with each baby that you have. And typically, depending on your insurance, it's going to be something that pumps both sides at the same time, that's electric, and it's going to be something that's really pretty good. So, that's a cost that some people are worried about is, okay, well, how am I going to pay for a pump? But that's usually something that you get with your pregnancy. So in terms of cost, breastfeeding definitely wins there. One thing I hear a lot about is just that it's easier to formula feed. And I tell people, when you are breastfeeding and you've got a great breastfeeding relationship with your baby, you can walk out of the house with your baby and a diaper. Like, that's it, because you've got warm breast milk ready to go no matter where you are.
Right.
You don't have to carry, find the right bottle that your baby likes. You don't have to switch formulas because their tummy is upset. And so that is one of the great things about breastfeeding, is that when you establish that relationship and when you get the breastfeeding relationship down, it's a lot. It's pretty easy. Pumping is different. Pumping, I tell people, it's kind of like a part-time job. Not to that extent. I don't want to scare anybody from pumping, but it does require a little bit of thought and preparation. And so if you're thinking about going back to work or school, or you're going to be separated from your baby for some reason, you really want to think about that in advance. I tell people, lactation consultants, those are people who specialize in education about breastfeeding, and they help moms a lot around the time that they have their babies. And that's great. I think that's a great time to make use of a lactation consultant. But another really great time is when you're planning to go back to work or school, to sit down with them, strategize, okay, how often am I going to pump? I know at work we have the break room in the fridge, or just to figure that out, because it can be kind of, it's something else new to figure out when you just had a new baby. So if those are some challenges you have that you're worried about it being hard, know that lactation consultants can help you there too.
Definitely. Thank you. Those are really good tips for being successful or increasing your chances of being successful breastfeeding. Now, while you're pregnant and you're having those conversations, with your OB, Dr. Coleman Henderson, what resources do you talk to your moms about to help their likelihood of breastfeeding and continuing breastfeeding?
So, just having that conversation with your OB-GYN, what are you planning to do? Think about it. I even say with the delivery, think about what you want, because don't get there and then try to figure everything out while you're in labor. So, we talk about the resources at the hospital, the lactation consultant. We talk about maybe having a doula there for you for support. And, there are some doulas that are even doing postpartum support that can help, or family members. Ask your mother, your grandmother, your aunt, your cousin, your best friend, ask them about their experience and what tips that they would give you. One thing that's very good about Texas is it really has moved toward breast-friendly services. So, when I had my children 25 years ago, you automatically got these bags when you were pregnant with formula from your OBGYN even before you delivered. And then the big thing when you went to the hospital was you were going to get another gift bag, and that gift bag was going to have formula too. And so everyone, when that went away, when we started moving toward breast friendly, moms were really mad. They're like, where's my gift bag? Because it usually was a diaper bag, a nice diaper bag. And so that was a big push, because they're like, I still want that bag. And so, but we have taken that away. Like hospitals, we do not want to encourage bottle feeding. Some people cannot breastfeed for medical reasons or whatever, or it's just not successful. And so, yes, we do have formula for those situations, but from the time you deliver to you go home, it's really reinforced to we will do everything we can to make you successful for breastfeeding. And so every mom is visited by a lactation consultant after they have the baby. And that lactation consultant is available after birth when they get home, and also the La Leche. I mean, there's so many societies out there. There's WIC. There's other resources within the community, and all of that is provided after they deliver, so that, once you get home, there's still some support, because it's really easy when you're in the hospital and the nurses are working with you and the lactation consultants working you, and you think you got it, and then you get home and you're like, wait, this is not what's going on in the hospital. So you need that support when you get home also.
Definitely. Those are really, really good tips. Now, what can families do to support breastfeeding moms? Because it's sometimes the stress of it of itself can decrease milk letdown and allow the moms to be relaxed. So what are some suggestions that you have for moms to be able to talk to their, those around them, to be able to help them a little bit more?
Well, every family is different. The dynamics, sorry, are really different. So it is helpful. And I see a lot of my patients, they have already thought about that. We have a very multicultural population at my practice. And so some people are having their in-laws come, or their mother-in-law or their mom come and already have that support system set up, because it is hard to be like, I gotta cook, I gotta clean, I gotta take care of the other kids, and I gotta take care of this new baby, and I gotta get back to work sometimes. So, having thought about that support system beforehand, and I encourage, that support system, even dad, to, lift the load a little bit. Let mom really have this time to focus on her and the baby. And even though they might be resistant, you can take care of the rest of the stuff for a little while, while she can just kind of focus on establishing that breastfeeding bonding with the baby and getting into her routine, because, there are a lot of emotional things that are going on, postpartum blues, postpartum depression. So there's a lot of things that the women can't control. Their hormones are changing, they're tired. And so whatever the support system can do to kind of lift that load and handle some of those extraneous chores, you might say, that would be very helpful. And so I'm always pushing for dads to do more, because my husband was great, and I thought all husbands were like that. So I talked to my friends and they're like, my husband did nothing. And I'm like, no, my husband would take turns, doing the bottle while I was, in the middle of the night. We had shifts. And so, I try to encourage my dads when they come to the appointments to be like my husband.
If I could tell a quick story about that, my husband, he worked the late shift. And so he would be with my first child during the day. And as soon as I walked home from work, I needed to pump. And he was just ready to hand off. He was like, all right, she's ready. I got to go to sleep. I was like, no, I need to pump. And his his anxiety about wanting to, do the baton pass did not allow me to express any milk whatsoever. And so I had to literally learn to tell me, can you just give me 20 minutes when I come home so I can, express this milk so you can have milk for the next day. Cause I think my daughter was about like 18 months around the time. So, but it was just one of those things where, trying to really balance and negotiate, to say, hey, I need this time. But yeah, it was off. It was interesting. But yes, husbands, partners, really key. Dr. Arnold, anything to add there?
Yeah, I think, if moms go into it educated about what to expect, that goes a long way. But even when you do that, it's hard to hear from grandma or, or dad, well, I really want to feed the baby. I want them to bond with me. Or your baby's crying all the time because you're not feeding them enough. And fat babies are happier babies. So hearing those messages can be really hard for women when they're going through, having a baby and all of the changes that go with that. So I would say, as a family member, your job is to really offer that support. Babies cry because they're hungry sometimes. They cry because they're wet sometimes. Sometimes they cry because they don't like the paint on the walls. Okay. Sometimes that's the only way they know how to talk to us, is by crying. And so we can't always say, oh, your baby's always crying because you're not making enough. You're not feeding them enough. So if you can be a person who can think of those positive messages to say, I mean, even I, a pediatrician, breastfeeding advocate, I heard, from my family members, we won't say which ones because maybe they'll watch this, but, well, when are you going to stop? When are you going to stop? Why do you have to keep breastfeeding? They're going to be spoiled. So those messages are not always, they're not encouraging. So as a family member, if you see that somebody's being successful with breastfeeding or they're having challenges with it, just cheer, root for them, figure out what they need and try to help them.
Definitely. That support is very key. Is there anything that you think we have not yet discussed? Any one thing you think our Black mamas should really know that you'd want to share with them? What would you like to share? Dr.
I would just say that be encouraged, because I think we get so many negative messages. And then sometimes, especially for young moms, it's overwhelming because everyone has advice, right? Everybody feels like they need to tell you what to do because you've never done this before. And so I just be very discerning about the advice you take and talk to your doctors, midwives, pediatricians. Talk to them because they will probably give you an unbiased and educated information, and not just an old wives' tale or what was passed down through the family and what might not be true or not. And like Dr. Arnold was saying, like, just the family members, I would just encourage them to be supportive, because just because you didn't breastfeed doesn't mean it's not the right thing for your family member. And I mean, that's what it's going to take, is education and support to increase our numbers. And we know the benefits of breastfeeding to the mom and the baby. So there's really, hopefully we've dispelled most of the myths that people come up as reasons for not to not do it, and that can encourage people to do it.
Yeah. And I didn't get to ask what's the recommended length of breastfeeding? I had mentioned my daughter being 18 months. My son was 3 months. So I was breastfeeding and giving the milk to my son, my second child. But yeah, what is the recommended length of breastfeeding?
So the recommendation is that babies have only breast milk for the first 6 months of their life. So we call that exclusive breastfeeding. And then after that, it's really up to the mom and the child. At 6 months is usually when you start introducing other foods. And so the breast milk has a little bit less of a role in nutrition and more of a role in bonding. And there's still some nutrition that you're going to get from breast milk, but it changes a bit at that 6 month mark. And then, so that's what the recommendation is.
Mm-hmm. Thank you. Thank you. Any last words from you, Dr. Arnold?
I would just add that, we're one of the only, nations, industrialized, prosperous, at least generally, countries that doesn't have like national leave for parents. We're in a population, Black women, who suffer from a lot of health conditions that at higher rates than other people. And I think of breastfeeding as like, it's almost like an act of rebellion. It's like there is all this stuff that might be hard for me or hard for my baby, but there is something that I can do for my baby that will help him or her that nobody else can do. And I love that. I love that it is something, it's a superpower. Not every mom can do it, but the vast majority of moms can. And for some people, it may not be the right choice, but for a lot of women, it is a superpower that they have, and it's one that we get to tap into. So I just tell people, like, your body's already done something hard. You've grown a baby, you had a baby, you can feed this baby. So just, I think adding to what Dr. Coleman Henderson said about being encouraged.
Definitely. Black girl magic. All right, I have to throw that in there. Any resources you think would be very helpful for our audience? Where can they learn more information about all the wisdom you shared with them today? Dr. Coleman Henderson?
Well, I'm gonna tell you, I'm not really ready for this because I know there's tons of websites out there that are really good. But locally, your La Leche, your WIC clinic, your OBGYN, there's a place called Mom's Place here in Austin. It's very helpful. And I was just going to add really quickly, though, because when you asked that question about how long you should breastfeed, I tell my moms who are kind of adamant that they don't want to breastfeed, just do it for the first week, because that baby is going to get some very powerful antibodies from you that will help their immune system in the future. And so even if you're like, I have to go back to work in 2 weeks and I'm not going to be able to do this, do it at the beginning. Like, even whatever little bit you can do is going to be helpful to the baby.
Definitely. That's very, very important because, you've got to give them some successes, and I think, you may start from a week and who knows, but at least being
and keep
optimistic.
going.
Yeah, that's awesome. Any resources, Dr. Arnold, before we end?
So kellymom.com is a website that gives good information. It's like Kelly, like the name Kelly, mom. And it's pretty easy to understand. You could read it, in the middle of the night, 2 a.m., feeding your baby, and the information there is pretty practical and reliable. Also, your lactation consultants. So many pediatricians' offices will have a lactation consultant. If they don't have one in their office, they may have a phone number or a resource that you can go to find somebody. If you're in the hospital and you're there for whatever, a short amount of time, prolonged period of time, ask for that lactation consultant. If you haven't seen them, you need to ask for them. If you're not sure if the hospital where you're going to deliver has them, you should ask that question beforehand. And then Black Mamas ATX. So that's a group here in Austin that focuses on improving the health of Black women around the time that they give birth. And so they may be a really good kind of hub for resources as you are going, the whole pregnancy, childbirth, and hopefully breastfeeding journey.
Thank you, ladies. This has been so insightful. Thank you for your time, Dr. Coleman Henderson and Dr. Arnold. We're so grateful for your expertise. And thank you to our audience for listening and wherever you are. ABPA wants to continue to further its mission to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. Please visit our website, austinbpa.com, if you or your organization would like to partner with us. If you have any interesting topics you would like us to cover on these webinars, please feel free to email us at info@austinbpa.com. Again, that's austinbpa.com if you'd like to learn more about us. Have a wonderful breastfeeding month and Black Breastfeeding Week.